This is Lois. She's an 83-year-old throat cancer survivor and one of many people in America who is suffering from severe aortic stenosis. She benefited from a less invasive procedure called transcatheter aortic valve replacement.
The aortic valve is one of the 4 valves that are within the heart itself, and it's the main valve that separates the heart from the rest of the body. Over time, the aortic valve can become calcified. As the calcium builds up, the area across the valve becomes very small, and consequently everything backs up. And that's really what happens with aortic stenosis.
It's caught when a physician or a nurse listens to their heart.
Symptoms of patients with aortic stenosis commonly are shortness of breath. They can have chest pain also. They can have other heart failure symptoms like swollen legs and trouble laying flat and breathing.
People start experiencing symptoms because the heart is not getting enough oxygen-rich blood to the body. They can often be subtle, but you may notice signs of aortic stenosis like tightness in the chest, fatigue, dizziness, heart palpitations, sensations of a rapid fluttering heartbeat, and difficulty walking short distances. However, it's important to remember that these symptoms may be signs of other diseases.
She liked to be outdoors and do a lot of walking, and she was a fast walker. There was a little hill outside our house here in the neighborhood, and she was having trouble getting up the hill. Normally, she would just go right on up the hills.
The severity of aortic stenosis is usually categorized as mild, moderate, or severe. It's very important to seek medical attention as soon as you have symptoms, because as soon as you develop symptoms, your risk for sudden death, dying suddenly, start increasing.
I had gotten up about 6:30 in the morning and I thought, I think I'll have a slice of toast. And the next thing I knew, I was lying on the floor.
She passed out while she was fixing breakfast, and that was kind of a wake-up call.
I guess it's about time I did something about this.
If you or a loved one are experiencing symptoms like these, see your doctor right away. Lois met with her cardiologist and he diagnosed her with severe aortic stenosis. After diagnosis, he decided to send her to a TAVR hospital for screening. A TAVR hospital has a heart team that specializes in treating people with aortic valve disease and has been specifically trained on the TAVR procedure.
A valve clinic coordinator is the first person that a patient will interact with when they get referred for their aortic stenosis. Our patients can see 5 to 10 different specialists during an evaluation here.
The TAVR heart teams take a team approach to evaluating your condition and coordinating your care. A typical heart team consists of an interventional cardiologist, a cardiothoracic surgeon, TAVR coordinator, echocardiographer, imaging specialist, and many other specialists involved with the TAVR procedure.
Typically, screening takes 1 to 2 days. We go through a thorough history and physical of the patient. They're also seen in clinic with our surgeon and with our cardiologists at that same time.
Other tests may include a frailty assessment, electrocardiogram, chest X-ray, echocardiogram, CT scan, and cardiac catheterization.
We do a lot of advanced imaging. We do a lot of CAT scans of the chest and the abdomen and also of the pelvis. We do a very detailed ultrasound of the heart, what we call an echocardiogram.
The only way to treat aortic stenosis is to actually replace the heart valve itself.
One of the critical decisions that we make after all the standardized tests are performed is whether the patient is a candidate for a surgical aortic valve replacement or a transcatheter aortic valve replacement.
She was a very high-risk patient.
Transcatheter aortic valve replacement is a less invasive alternative for people with severe symptomatic aortic stenosis who are high risk or too sick for open heart surgery. Your heart team will decide which option is best for you.
The doctors laid out what the options were. We talked about it as a family and decided that this heart valve replacement was the best way to go.
At that point, the discussion with Lois and her family led us to do a transcatheter aortic valve replacement.
The TAVR procedure is a very unique procedure, and it's based on the idea that we can take a heart valve and collapse it to a much smaller size and then introduce it into the patient's body and expand it to its normal size, which will take over for the old disease valve.
The next decision is transfemoral versus transapical.
There are two approaches to TAVR therapy, transfemoral and transapical. Because of the size of the arteries in her legs, Lois was a transapical candidate.
Transapical approach is where you make an incision underneath the left breast and we put our tube directly into the heart. The TAVR procedure is usually done in a hybrid suite. So we have two teams present, a team that work with catheter procedures, and we have a group that works with open surgical procedures.
My role on procedure day is to talk to the patient to let them know that they're not going through this process alone.
When you arrive at the hospital, the heart team will get you ready. This includes running a series of tests, explaining the process, procedure prep, and administering general anesthesia.
A 5 to 8 centimeter or 2 to 3 inch incision is made generally underneath the left breast. We're able to gain access to the apex of the heart, which eventually will become the place that we place our delivery sheath, which will allow us to place the valve directly into the heart and position it right where we need to. And we're able to expand the valve and deliver the valve.
We saw her shortly after she came out of the OR in post-op.
After the procedure, the patient will go to the ICU at least overnight for careful monitoring.
The first 48 hours are critical.
Some major risks associated with the transapical procedure include death, stroke, and major bleeding.
Assuming that everything goes okay, our patients are transferred out to the floor the next day.
I could tell when I started walking down the hall. I could not believe it.
So Mom was in intensive care for 3 days, and then she spent another 2 days in the hospital, and then she came home after that.
Post-procedure follow-up care is for our patients is they return to our clinic 1 month after the procedure. We do another echocardiogram to see how the valve is functioning and also to reassess the patient and their medications.
And there's not a moment I say, well, maybe I shouldn't have had this done.
There's still a lot of things we're learning about transcatheter valves, so it may not be right for every patient.
I am walking up the whole hill without stopping. To me, that's a real accomplishment. I'm doing quite good on that hill.
Getting back to her home, she was very important for her and a very happy moment.
I remember sitting in the car and saying, I can't believe I'm going back to my own home in Florida.
TAVR may not be right for you. Please see a heart team to learn more about TAVR. To find a TAVR hospital near you, use the locator on newheartvalve.com.